Last month, I reviewed the chart of a 69-year-old man named Robert. His arteries were so hardened, they barely showed up on the scan the way they should. He was taking 3 blood pressure medications, and his numbers were still dangerously out of control. Robert wasn't giving up. He wasn't being careless. He was following every single instruction his doctors gave him. And still, there he was, right back in my office. But here's what nobody had ever told Robert. And what I'm going to tell you today. The answer was sitting in his kitchen the entire time. 5 simple things. No new prescriptions. No side effects. Just food, doing what food was always designed to do. Stay with me, because by the end of this video, you'll know exactly what to start doing tonight. Here's something most people over 60 never hear explained clearly. Your blood pressure doesn't just rise because of stress or too much salt. After a certain age, something deeper is happening inside your blood vessels. Think of your arteries like a brand new rubber band. When it's fresh, it stretches. It flexes. It handles tension without snapping. But leave that rubber band in a drawer for years, and it becomes stiff, brittle. It can't absorb the same pressure it once could. That's what's happening inside your body right now if your pressure is climbing. I've spent over 2 decades in cardiovascular medicine. I've reviewed thousands of patient cases, men and women in their 60s, 70s, even 80s, and I keep asking myself the same question every single time things reach a crisis point. How did it get this far before anyone stepped in? The answer, more often than not, is this: chronic, silent inflammation. Not the kind you feel when you twist an ankle. This kind has no obvious symptoms. It burns slowly, quietly, deep inside the walls of your blood vessels, year after year, stiffening and narrowing them. And your heart, trying to keep up, just pushes harder and harder. So why does food matter so much here? Because every single meal you eat is either calming that inflammation or feeding it. Most people have no idea. And honestly, most appointments just don't allow time for this conversation. That's exactly why I'm here. I want to be clear. Nothing I share today is meant to replace your medication. Please don't change anything your doctor prescribed without talking to them first. What I'm giving you are 5 powerful tools that work alongside your care, tools that, in many of the cases I followed closely, have made a remarkable difference. Sometimes within just a few days. Are you ready? Let's go. Let me ask you something. When you sit down for dinner tonight, what do you eat first? For most people, it's a roll, a scoop of rice, maybe a cracker while everything's still being served. I want you to try something that sounds almost too basic to matter, but the science behind it will surprise you. Eat your vegetables first, before anything else on your plate. Every single meal. Here's why it works. The fiber in vegetables creates a kind of natural barrier in your digestive tract, almost like a mesh lining. And that mesh dramatically slows down how fast sugar from the rest of your meal floods into your bloodstream. Why does that affect your blood pressure? Because every sharp spike in blood sugar triggers your body to release a surge of insulin. And that insulin surge causes your blood vessels to tighten right there at the dinner table, while you have absolutely no idea it's happening. I followed a retired school librarian named Carol, 73 years old. She changed nothing else. Same meals, same portions, same medications. Just the order. Vegetables first, then protein, then her bread or potatoes last. Within 2 weeks, her post-meal blood pressure readings had dropped noticeably. She told me that was the simplest thing I've ever done and actually stuck with. She was right. So tonight, before you touch the pasta or the biscuit, finish those greens first. Every bite counts. Coming up next, something that's probably been sitting in your pantry for years, doing absolutely nothing for you. We're about to change that. Apple cider vinegar. 1 to 2 tablespoons stirred into a full glass of water with every meal. I can already sense the skepticism. And honestly, good. I'd rather you question me than follow anything blindly. So let me walk you through exactly why this works, because the research is real. The active compound in apple cider vinegar is something called acetic acid, and it does 2 very specific things for blood pressure. First, it improves how well your cells respond to insulin. Remember those blood sugar spikes that squeeze your vessels after a meal? Acetic acid blunts that spike. Your body releases less insulin. Less insulin means less constriction, lower pressure. Second, and this is the part that genuinely stopped me when I first read the data, acetic acid stimulates your blood vessel walls to produce nitric oxide. Nitric oxide is your body's own natural vessel relaxer. It tells your arteries to open up and ease off. It does almost exactly what an entire category of prescription medications tries to do, and it costs about $3 a bottle. One caution: never drink it straight. Always dilute it in at least 8 ounces of water. Undiluted, it can wear down your tooth enamel and irritate your throat. Use a straw when you can. And if you have a history of acid reflux or stomach ulcers, check with your doctor before starting. But for most people over 60, this is one of the safest, simplest additions I know of. 1 glass at breakfast, 1 at lunch, 1 at dinner. Give it 3 weeks and check your numbers. Have you ever tried apple cider vinegar? Drop a comment. I'd love to hear what you've heard about it, or whether you've tried it before. Do you check your blood pressure in the morning? Most people do. But here's what almost no one is talking about. What is your pressure doing while you sleep? For a lot of people over 60, blood pressure doesn't drop the way it's supposed to at night. It should lower, it should give your heart a break. But in a condition called nocturnal hypertension, it stays elevated or spikes while you're lying there completely unaware. Your heart is working overtime. Your arteries are under stress. And you wake up the next morning feeling worn out, wondering why. Nocturnal hypertension is one of the most underrecognized patterns I see, and one of the most dangerous. It's directly linked to a higher risk of stroke and heart attack. And here's the troubling part: your regular daytime readings won't catch it. You can have perfectly normal morning numbers and still have a serious problem happening every single night. So, what do walnuts have to do with any of this? Quite a lot, actually. About 30 grams, roughly 14 halves, eaten 30 minutes before bed, has been shown across multiple studies to meaningfully reduce nighttime blood pressure. Here's why. Walnuts are one of the richest plant-based sources of a specific omega-3 fatty acid called ALA. They also contain melatonin and a compound called L-arginine. Together, these 3 things help relax blood vessel walls, reduce vascular inflammation, and support that natural pressure drop your body is supposed to make at night. Think of it as sending a signal to your cardiovascular system. It's time to rest. 30 grams, 14 halves, 30 minutes before bed. Write that down. It's one of the simplest things I recommend, and one of the most consistently effective. I want to tell you about a flower. A deep crimson flower that traditional healers across Latin America, Africa, and the Middle East have relied on for centuries, and that modern cardiology has finally caught up with. Hibiscus tea. 3 cups a day. You may already know it by another name: sorrel, agua de Jamaica, or simply red tea. It has a tart, berry-like flavor, and it is remarkably powerful. Hibiscus flowers contain natural compounds called anthocyanins and hibiscus acids. And these compounds act on your blood vessels in a way that's strikingly similar to a class of prescription drugs called ACE inhibitors, one of the most widely prescribed blood pressure medications in the world. What ACE inhibitors do is block an enzyme that causes your blood vessels to tighten and constrict. Hibiscus does the same thing naturally, without the dry, persistent cough that sends so many patients back to their doctor complaining about the medication. A study published in the Journal of Nutrition found that daily hibiscus tea reduced systolic blood pressure by an average of 7 points in people with mildly elevated readings. 7 points. That is clinically meaningful. That's the kind of result that makes doctors pay attention. 3 cups a day, hot or cold, your choice. No sugar, or as little as possible, because sugar will work directly against what we're trying to accomplish here. A small drizzle of honey is perfectly fine. One important note: if you're already taking an ACE inhibitor medication, please talk to your doctor before drinking hibiscus tea regularly. Combining 2 things that do the same job can push your pressure too low, and that's not the goal. We want improvement, not overcorrection. But for most people, this is honestly one of the most enjoyable changes on this entire list. A warm cup of red tea in the morning, 1 in the afternoon, 1 in the evening. Your arteries will thank you. What tea are you drinking right now? Tell me in the comments. I'm genuinely curious how many of you are already helping your heart without even realizing it. After this video, I want you to walk to your kitchen, Open the cabinet where you keep your cooking oils and take a close look at what's in there. Because what I'm about to share might be the single most important thing in this entire video, and it's something the food industry has spent a lot of money making sure you don't fully understand. Most of the oils filling grocery store shelves, canola oil, vegetable oil, soybean oil, corn oil, are loaded with omega-6 fatty acids. Now, omega-6 isn't poison. Your body needs some of it. The problem is the ratio. For most of human history, people consumed omega-3 and omega-6 in roughly equal amounts. Today, the average American takes in anywhere from 15 to 20 times more omega-6 than omega-3. 15 to 20 times. And that extreme imbalance is one of the primary drivers of chronic systemic inflammation, the same slow-burning inflammation in your blood vessel walls we talked about earlier. The kind that silently stiffens and narrows your arteries year after year. It gets worse. These refined oils are chemically unstable at cooking temperatures. When you heat them, they oxidize and break down into compounds called aldehydes, which are directly toxic to blood vessel walls. You can't taste it. Your food looks perfectly fine, but the damage builds quietly with every single meal. So, what should you use instead? 2 things. Extra virgin olive oil for everything that doesn't require very high heat. Salad dressings, light sautéing, drizzling over vegetables and fish. Extra virgin olive oil is rich in a natural anti-inflammatory compound called oleocanthal, and it actively supports healthy blood vessel function. Decades of solid research back that up. And for high-heat cooking, real butter. Yes, real butter, not margarine. Margarine is made from the same refined vegetable oils we're trying to move away from. Real butter, ideally from grass-fed cows when you can find it, used in reasonable amounts, is a far better choice for your heart than the seed oils most Americans are cooking with every single day. I know that goes against what many of you were told 20 or 30 years ago. Butter is bad, use vegetable oil, that message was everywhere. I heard it too, but the science has moved on, and what we're seeing now points clearly in a different direction. Check your cabinet tonight. You don't need to throw anything away right this second. Just, when the canola runs out, don't replace it. Bring home a bottle of extra virgin olive oil instead. That one swap, over 3 to 6 months, can make a measurable difference in inflammation and in your blood pressure. I want to pause here for just a moment because I think something important needs to be said. You've just heard 5 things. Eat vegetables first. Apple cider vinegar with meals. Walnuts before bed. Hibiscus tea 3 times a day. Replace the oils. And I already know what some of you are thinking right now. This sounds too simple. If it really worked, my doctor would have already told me. I completely understand that reaction. I had it myself early in my career. But here's what years of working with real patients have taught me. The most powerful changes are almost never the most complicated ones. Your body isn't looking for complexity. It's looking for the right conditions to do what it already knows how to do, heal itself. And here's what still surprises me, even now. Every single one of these 5 strategies works through the same underlying mechanism: reducing inflammation, improving blood vessel flexibility. That's it. 5 completely different approaches, all leading to the same result. Robert, the patient I told you about at the beginning, after we had a long conversation about everything you've just heard, he started making these changes one at a time, slowly and carefully, in full communication with his cardiologist. 6 months later, he came back for his follow-up visit. His doctor had taken him from 3 medications down to 1. His inflammatory markers had dropped significantly. His pressure was stable, genuinely stable, for the first time in years. He looked years younger. And when he sat down across from me, the first thing he said was, "Why didn't anyone ever explain this to me before?" That question stays with me. It's a big part of why I do this. The research is out there. The information exists. But somewhere between the studies and the doctor's office and you sitting at your kitchen table, it gets lost. You're sitting at that table right now, and you have everything you need to start tonight. Not next week. Not after your next appointment. Tonight. Let's bring it all together, because I don't want you closing this video and forgetting everything by tomorrow. 5 things. 5 changes. Here they are one more time clearly. 1. Eat your vegetables first at every single meal. Before the bread, before the rice, before anything else. 2. 1 to 2 tablespoons of apple cider vinegar in a glass of water with each meal. 3. 30 grams of walnuts, about 14 halves, 30 minutes before bed. 4. 3 cups of hibiscus tea every day, hot or cold, minimal sugar. 5. Replace your canola and vegetable oils with extra virgin olive oil and real butter. No exotic supplements. No expensive equipment. Nothing that needs a prescription. Here's what I want you to do right now before you close this video. Pick just one, not all 5. Just one that feels most doable for you tonight. Maybe it's eating your vegetables first. Maybe it's ordering some hibiscus tea online. Maybe it's just walking to that cabinet and reading the labels on your oils. One thing. Start there. Because lasting change doesn't come from overhauling everything at once and burning out by the weekend. It comes from one small decision, repeated consistently, until it just becomes the way you live. I've seen this work. Not in theory. In real people in their 60s, 70s, and 80s who decided it was not too late to give their bodies something better. It is never too late. Your blood vessels are far more responsive than most people realize. Give them the right environment, and they will respond. Which of these 5 are you going to try first? Tell me in the comments. I read every single one. And if this helped you or someone you love, please share it. There are people in your life right now who need exactly this information and have no idea it even exists. If you're not subscribed yet, please do. Every week I bring you honest, evidence-based information that I wish every patient had access to long before things became urgent. Take care of your heart. It has been working for you every minute of your life without ever asking for a single thing in return. It deserves this. One last thing, and this matters. Everything I've shared today is general information based on current research and my clinical experience. It is not a substitute for your personal medical care. Please do not stop or adjust any medication your doctor has prescribed without speaking with them first. Bring these 5 things to your next appointment. Have the conversation. Your doctor is your partner in this. And these strategies work best when they work with proper medical supervision, not instead of it.